My name is Dr. Brian Futrell. I'm a certified wound specialist out of Raleigh, North Carolina. And I want to come to you and sit down with you and talk with you today about wound care and compounding. Here is a partnership through PCCA and your local pharmacist. We're going to present a case of a difficult to heal wound, and I just really want to bring to you some options with utilizing compounding and how you can benefit your patients. While we're going to focus on spear wash today, there's poloxamer gels, polyox, there's multiple products and bases available to you, and it's specific to each patient. But we're going to focus real quick on spear wash, phenytonin, and misoprostol. The patient we're going to talk about today is an 87-year-old female with a history of diabetes, hypertension, and early stage renal failure. Here, as you can see, the wound, 6 months of age, can show difficult margins or poor margins. This is a very common difficult healing wound and often requires very advanced techniques and modalities, including biologics and even skin grafting. This wound, present for 6 months, we initiated a compound of spear wash, phenytonin, and misoprostol. In our long care term facilities, it's often very, very difficult to create a formulary that's effective for the patient, but also user-friendly for our nursing staff. We initiated the compound for a 4-week period of time, applied 3 times a week. Whatever schedule you want to do, Monday, Wednesday, Friday, Tuesday, Thursday, Saturday, that's okay, but the idea is consistency, and again, this is going to be very user-friendly for your nurses. As you can see here, initially we have some necrotic tissue, we have some fibrotic tissue. The wound margins are not what we would like them to be. There's some stunting, encroachment there. Also, you can see some violaceous appearance to the peri-wound skin, induration. This is really showing us a wound that's starting to stall, really not going to go on to the level of healing that the patient requires. And as we also understand with diabetics, the longer they're open, the more likely we're going to have complications. And complications not only lead to increased cost, but comorbidity and morbidity mortality issues for our patient. After a 4-week period of time, we can now begin to see an improved peri-wound skin, better epithelial encroachment or skin growth across the wound. We also can recognize a very healthy granular wound bed. This wound tells us the story that it's going to go on to healing. Unlike the initial wound, which was, it didn't look terrible, but it was not going in the direction it was starting to stall. This wound is going to push through, it's going to heal, and you get to look like the hero. Best way to bring this therapy to your patients is in a relationship with your local pharmacist. PCCA is there to educate you and your pharmacist, but ultimately it's that relationship with the nurse, yourself as the physician, and your local pharmacist that is going to bring the best outcome for your patient.